Hi, Jimmy. I'm Lindsay. I'm going to be your nurse today.
Hi.
Can you tell me why you're here today?
Well, I was playing out in the yard with the grandkids, well, the great grandkids, and we were throwing the ball, and I overdid it, and it's been a week and a half, and I'm still just wore out. And as I know, I'm sure you know, I've had some emphysema issues, and although it's not bad, that episode got me.
Okay. Did anything make it worse?
No, just the playing in the yard. I mean, I knew I shouldn't do it, but we were just having a good time.
Okay. And what'd you do to make it better?
Well, that day, I mean, it was early in the day, so I napped most of the afternoon, and like I said, then I've just been resting, and I've stopped doing kind of the stairs in the house. I don't really have to do them, so I kind of let my wife do the cleaning or whatever up there.
Okay. And had you had an episode like this before?
Yeah, I've had a time or two where I've overdid it. Usually it's just horseplay when the family's around, but I'm learning.
Okay. And then last time, did the symptoms like the shortness of breath and stuff, did it last this long?
It was probably about a week. Like I said, it's been about a week and a half this time, so.
And what'd you do last time to make it better?
Just rested for a few days and seemed to get better.
Okay. Well, we're going to do a short assessment today, and we'll see where you're at.
Okay. Sounds good.
And today I'll just have you leave your shirt on, but normally you would take off your shirt.
Okay.
So we're just gonna assess your upper body today.
Okay.
So I'm gonna take a look at your hair, and I noticed just by looking at you that your hair is not dry or anything, and by looking at your face, your features are symmetrical. I don't notice any lesions or anything out of the ordinary. Are you hard of hearing?
I am. I put them in today. Even checked the batteries for you. My wife wondered why I don't do that for her.
Yeah. Okay. Well, if you don't mind, I'll have you look straight forward, and I'm just going to take a look at your eyes and see if your pupils react, which they do. And I noticed that your nose, it looks like on this side it's not as symmetrical. Have you broken your nose in the past?
I have.
Okay. I'm just going to take a look up your nose. It does look like you have a deviated septum. Can I have you open your mouth and kind of stick out your tongue? Okay. You can see your tonsils, and it doesn't look like you have any issues with your teeth or anything like that. It looks like you're well hydrated. Your mucous membranes are moist, and they look good. Let's see. I noticed that your ears are in alignment, but you are hard of hearing, so you have hearing aids. I don't notice that your jugular veins are distended or anything. I am going to feel for your lymph nodes, though. And I can feel your carotid arteries. And everything seems to be in alignment. Okay. So now I'm just going to take a look at your skin, and everything looks normal for your race and ethnicity. I don't notice any lesions, and I'm able to feel your pulses. They feel like a 2+, which means that they're normal. And your nails all look good. and you have good capillary refill. So if you don't mind, I'm going to listen to your lungs. Have you take a deep breath. Okay, I'm just going to listen to your heart now so you don't have to breathe so deeply. I'm going to listen to your bowel sounds. Come around your back. I'm going to listen to the back side of your lungs, so I'll have you take some deep breaths. Okay. I'm just going to feel your back and make sure there's no lumps or anything that shouldn't be there. And everything feels symmetrical. Is there any soreness or anything?
No, just real short on breath, just tough to get going.
I'm just doing a little palpation and percussion on your back, so I'm listening to your lungs, and everything sounds normal. So now I'll go ahead and do your vital signs. 20/80. And also if I would take your pulse ox to see what kind of oxygenation you were getting, what percentage at room air, and then we could see if you would need oxygen. Take your pulse. And then I would count your respirations. Okay, Jimmy. I think that's all for me, and the doctor will be in with you soon.
Sounds good. Thank you.